I'm Corey Hughes with Ried Physical Therapy. One common thing that I kind of hear from a lot of people is about a pretty common sound that we've all heard before, and that's that knee pop. So, knee popping is something that can really raise concerns for people, especially if it's something that's kind of new for you. Knee popping, though, let's just be clear here, it's not necessarily something that's going to be dangerous for you. Knee popping is one of those weird signs and symptoms, and there's a lot of research that's kind of unsure about where that popping is coming from and what's going on. So a lot of times the knee popping really doesn't tell us a lot about what's going on at that knee. And a lot of times that knee popping can just not really tell us anything. Sometimes if this is going on a few months though, that's where we can start to identify that's probably related to some kind of dysfunction. So that prolonged popping, especially popping that's starting to become associated with pain, is something that indicates that there might be something deeper going on that needs to be assessed. A lot of times that can mean that a smooth surface has become a little bit worn down and maybe not quite as smooth anymore and is popping around the spot where it's meant to be riding, something like a kneecap or a joint that maybe isn't riding correctly, or something is starting to catch and thump over one of our bony prominences. Either way, that's something that can be addressed with physical therapy, and a lot of times early assessment is key to making sure that those structures don't become further damaged down the road. So if you start to notice popping, the best idea, especially if it's something that's been going on for a few months, the best idea is going to be contact your physical therapist, see what they can do to help you out, and get them to do a full assessment to make sure that these joints are lining up correctly and we're not doing anything long term as well. So that joint popping is something that can be normal, something that can be indicative of something a little bit more serious. Definitely something that you want to get checked out if it's been going on for a while, and earlier rather than later would be best for that as well.